Good morning and good afternoon and even good evening if you're joining us internationally from some of our international viewers here. I'm Professor Greg Heffernan. I'm Vice President of Academic Affairs for Residency Medical. I want to welcome you to our webinar on how to prepare for the 2023 ERAS season. I have two wonderful guests that I'm really delighted to welcome. Dr. Iván Rodriguez, who is a program director of family medicine in the Florida area. And we also have Dr. Venkat Thungathurthi, who is a PGY1 internal medicine resident in the New Jersey area. And I think their experience and insights as to what makes a competitive ERAS application, CV, personal statement, and clinical experience, I think will be very insightful to all of our viewers. So first up, I kind of want to talk a little bit to Dr. Rodriguez. And Iván, can you share with me a little bit how applications have kind of changed over the years now in terms of numbers and what you look for?
Yeah, it's been one of the things that I tell every applicant, and because I know it have to be frustrating when you're applying to a program and you don't get in. It is difficult to get in, but it's not impossible. Things have changed a lot, and they keep changing. I don't want to see for the worse in the terms of the numbers. Let me give you an example. When I started this program, I think like 15 years ago. We started with 6 positions for family, 6 for IM, and 12 for psychiatry. And we were kind of struggling getting getting applicants for the program. As time went by, we used to get, for my program in family, we'll get maybe 20, 30, 40 applicants for 6 positions. Last year, I have 1,500 applicants, roughly, for 9 positions in my program. So you could imagine how difficult or how competitive it might be. One of the keys for whoever is applying, you have to try to find a way to stand out, and you have to be able to reach out to the different programs that you're applying and have to create a connection so they know who you are. With the amount of the volume that we're getting nowadays, it's difficult. So I just try to pick up what's best on the application, and even then, I can tell you I could cut from 1,500, bring it down to maybe 300-400, which still is a humongous number to be able to choose nine people for the program.
That echoes what we hear nationally across the United States with a lot of family medicine programs. And Dr. Venkat, do you must have some interesting stories of being part of that pool in ERAS there and trying to make.
So, hi, I'm Dr. Venkat. As Dr. Rodriguez said, it's very important for you to stand out of 3,000, 4,000 applicants, and make your position. So I am from India, and when I came to US, it was very difficult for me to grab attention of program directors because there were many students who were trying for the same position. The resident medical helped me to get into a position.
Sounds like in terms of your application and putting together those things, whether it's the CV, personal statement. I know Residency Medical was very helpful in helping that. We do extensive support. We actually have program directors that help look over those personal statements and the CVs to see, that it's got key elements that includes any research you've done, any clinical experience. Dr. Rodriguez, with regard to personal statements, how important is a good personal statement if you are finally looking over that applicant's application?
That's one of the crucial things. I know that taking the test, passing all your testing, and the score is important. But when you get to the point of picking up some of those people that we're going to consider, the personal statement have to stand out, have to be strong, and have to be sincere. Most of the time, you could see when somebody is kind of forcing something is not really sincere. So you have to come through like you mean what you're saying, and you did what you said you did, and you went through those experiences that you are talking about on your personal statement. As I said, as it states, it's a personal statement. So make it personal, make it stand out, and make it sound very sincere, because that's very important.
Because you are a primary care family medicine program director, are you looking specifically if they, for their U.S. clinical experience, that they've got like clinic-based primary care clinical experience? Are you
Yeah,
looking for?
the clinical experience is important. Again, you have to be able to mix and match your personal experiences along with your clinical background and clinical experience, especially for the international medical graduate coming to United States to do a residency. Even though I see some people are really well prepared, but our system here might be a little different and takes time to adjust. So show how adaptable you might be to different situations, and how you're going to be able to incorporate yourself into our system here in the States.
I have a question, Dr. Yvonne, and then Venkat, I'll ask you as well. Oftentimes, these applicants, if they're international graduates, but even some of the U.S. grads, if they're applying for specifically family medicine or internal medicine, should they have a rotation at least 4 months in each, or two of one of the other?
Um,
Yvonne, if when you look at
Yeah,
the CV.
that's a very important point. I mean, and that in my case, that's one of the things that I use for selecting a candidate. So one of the things, the people that I do consider, they have to rotate with me. They have to be able to be with me. In the longer they are, the better. Minimum 4 to 6 months, so I could see who they are, how do they interact with the whole system. It's not only with me, how do they do their patient care clinically, and how do they incorporate into the team that they're going to be working with. That's the time that you're going to have to shine. And at that point, the application is important. But if you do an excellent or outstanding job, and I got multiple examples of people like that, your chances increase a lot.
That impression over those series of months certainly gives you a much clearer idea of the attributes of a resident rather than a 45-minute interview where
Yeah,
you're you're
yeah, and then
really.
on the same token, I mean, I have people that when I look at the application and they got a stellar application, impressive. When they come to work with me and with the team, they really don't have what we're looking for. They might not be a team player. They might have some attitude. They might not be able to incorporate into the system. So that's what I said. They have to be able to really show me what they can do. Don't try to impress me by how much they know. I know most of the people that are applying, they've been studying for a long period, for a long time. So they're excellent. And most of them, if not all of them, are people that are very smart. Uh, I would say they're way above average. So I know they're intelligent and they're smart, but they have to be able to work with people. We're doctors, so that's key. That's an important key.
So, as Dr. Rodriguez said, it's very important to work as a sub intern. I mean, I worked as a sub intern for 15 months because I want to show like how good of a doctor I am, right? So no one will believe me if I work. So I came from India, and if I worked in India, so why would someone believe me if I say that I did so many I saw so many patients. I know this case. I know this case. Oh, so it's fine. I mean, they can believe me, but they have to see me to believe me, right? You have to actually work, and you have to prove that you are a good doctor, and you have to actually prove that you're a good team player as well, because there are like 10 people in a residency. Example, like there can be less or more, but if there are more people in a residency, you have to fit in. It's not like you like individually take care of patients. It's a teamwork.
I got my what's called my spies. which usually are nurses, and I weekly I get information. I get from further from the residents how they've been behaving, how they've been acting, have they been able to work as a team, are they good doctors. So all that information I get it from the people that are watching everybody that's rotating. That's one of the reasons it's so important. So they could be noticed by everybody in a good way.
Because you're both in different regions, even though you're different specialties, internal medicine up in New Jersey and Florida in primary care. One of the things that we often advise too is that the applicants should do their homework about the area, the region, the people, and even the research that maybe goes on there. But Dr. Rodriguez, I know you have a large Spanish-speaking contingent there in Florida. How important is that to be Spanish speaking as an applicant?
I mean, it is important, but it's not as something that I consider. I mean, most of the people, by the time that if they get selected and are good enough, by the time they start, can get by with medical Spanish. So getting a translator is not difficult, but the more independent that you are, the more that you do everything on your own, the better. The better impression you're going to cause.
Dr. Venkat, your residency there in New Jersey it's outside of the major urban areas, but you have a particular patient demographic that you serve, correct?
Correct. So here, so fortunately, most of them are Indians. They speak Hindi, so I know Hindi. But when I worked in Miami under Dr. Rodriguez and under Dr. Frontella, I learned a little bit of medical Spanish because patients has to trust a doctor. Then they can open up and they can say what's the problem is. So they can talk freely. They know they think that we are family.
Yeah. Dr. Rodriguez, quick question. In terms of your chief residents over the years, they probably have always recommended or represented when they came in a certain quality of a resident that you really, like to see. How would you sum that up in terms of chief resident?
We as a physician, and I tell this to all my residents, we are always leaders. I mean, people are going to be looking up to you. People are expecting for you to be able to take charge. As I mentioned before, I don't get too impressed with how much medicine they know. I know they know a lot. They've been studying for a long time. So my thing is, how do they apply that knowledge to the patient and to the patient care? How do they communicate that to the not only the patient with the family? So they have to incorporate all those things together. That's one reason. Even though Spanish is not that important in Miami's case, it will help them a lot. You have to be able to guide everybody. Your whoever the student that you've been working with, maybe some other survive, the patient and the family. You could see them; they do stand out. They're very friendly. They know how to talk to people. They don't talk people down. And when they don't know, they don't know. They ask. They're humble and they know what to ask, and they're not their place. So, and that's very important.
Those are wonderful qualities in any resident to look for that. So we've got ERAS coming up at the end of this summer, and there's certain elements of the application that are obviously going to be needed to either stand out or even to get an interview. How do you really, let's say, if your scores are not real high, let's say they're in the low 200s, maybe you've got an attempt. How do you rectify that to make yourself more competitive? Venkat, any thoughts on that specifically?
Yeah. So coming to my story, actually, I had some red flags. I applied twice. One without resident medical, and the second time with resident medical. So I didn't know the first time. I was a newbie to the system, and then I actually contacted resident medical, and they actually helped me to get a spot. But they refined my ERAS. They refined my resume, So they spotted, okay, so this is something you have to change. And I did that. And fortunately, I got a spot.
Oh, Dr. Rodriguez, we talked about the importance of a personal statement, and it sounds like they should have some clinical experience that reflects that specialty, certainly. Is there any other points that might stand out in ERAS for a person?
I mean, as I said, you have to find that keywords and don't have the. Well, so sorry, when I'm reading, I could see them, but I got to. I don't have a list of those words. But once you see that they stand out, especially with people that are having issue with scores and they struggle with the testing. I mean, uh, I usually try not to look at those until I get to the point that I got too many people I have to screen it somehow. And that's why when that personal appearance, when that rotation comes into play to show me that, okay, my score wasn't that good, but this is what I can do in real life. Besides, I get this a lot. One of the things that when they come and talk to me, oh, I'm too old. I know I'm too old because I've gone so far back. For me, age is actually a plus. Most of the people that are a little bit older have more experience, are more mature, and that dealt with situations in life that maybe younger people have never done. So I don't want anybody to get discouraged because they're older. I have residents that started with me when they were over 50, okay, and they were able to finish their training, and that's what their dream, and they got it. So do not get discouraged by age. I, I, I look that as a plus, not as a minus.
Somebody has sent in a question. It says that they might not get their LORs until after August or September. And that's when they're going to be doing their U.S. clinical experience. Will it affect negatively the ERA application? It sounds like they'll have to submit them a little bit for that. Any thoughts on that, Dr. Rodriguez? And then
As long as they're on time and they get a chance to be able to rotate and uh, show what they can do, um, we, as I say, the fact that they go through eras and everything, it's the kids try to get that interview. By the time you get the interview, we usually got all the paperwork needed, including the letter of recommendation. So it is important, but it's not that crucial. I'm not worried about people. If I get an application and I'm missing a letter of recommendation here and there, I usually look a way to get it, especially if I'm considering them for an interview.
we have Elizabeth sending in a question, and her question is, what is the minimum number of months of U.S. clinical experience needed to procure residency? Dr. Rodriguez, what would you say for
I
that?
mean, I always tell them the same thing. The more they could spend time with me, the better. Not only that, if sometimes you see somebody that got the potential, but they need some polishing in some certain areas. So we got time to work on that. And I have people that I try. They spend with me sometime over 6 months, but because I really saw the potential, but they were not able to overcome whatever they had that they couldn't make it through. So if they could be with me the longer and we could work together to polish you up, you might say, to make you shine by the time you get to the interview is better. A minimum, I would say a minimum of 4 months, it would be perfect, just to make sure that we could see you and everybody can see you. And I get the feedback from the staff and the other residents and survivors.
So we have a question from Florencia, who's saying that with COVID restrictions with travel, is that going to be taken into consideration for U.S. clinical experience? Because I know a lot of international graduates are having difficulties with a visa to come and do clinicals. I think the interviews are going to be virtual again this year. Is that correct, Dr. Rodriguez? So
We,
how would that affect their
I mean,
application?
it is a problem. One thing, and I'm gonna be honest, soon I'm getting used to all these meetings and rotation, long distance, but nothing beats being in person. But even with the COVID, I got people that actually started with me, rotating a few months, then they went back to the country and they finished up part of the rotation via Zoom. Nothing beats being in person. So the restrictions are tough. I don't know how things are gonna go. Uh, but if you could be in person, not interviews, I like to be in person too. But this past year, we did a lot on Zoom. There was no other choice.
Dr. Rodriguez, is it better to have done clinical experience like in an actual ACGME program? Does that look better on the outpatient
Yeah,
residency, obviously, or university based?
yeah, it always helps. But the key is again, you have to show, especially since you mentioned the nursing home, what you can do with type of patient. Usually, people are not familiar or aware how difficult it is to deal with the geriatric population and all the complications and comorbidities. Plus, in the nursing home, they get, besides hands-on, they get sometimes to get some simple procedures, and they can show me how skilled they might be. I had some people in the past that they really struggle at the beginning because you have to be able to incorporate yourself to a system. If you come in some other part of the world, the system might be different, and some of the stuff that it might be, I wouldn't say shocking, but they could be, and people get frustrated. So that again, that's why I keep coming back to the same point. If you be able to rotate and be here and get used to our system, it will increase your possibilities or your chances of getting in, because you could show that you could do it.
Well, I want to thank you. We're going to wrap up here. I want to thank both Dr. Vaughn and Dr. Venkat for their insightful sharing. From what I'm seeing from the audience, they really got a lot out of your information in terms of applying for ERAS this coming year. And, we wish all of those who are listening in excellent attempt to come into the ERAS. Please feel free to contact Residence Medical. We've been spending years helping, as I said, both U.S. grads and international grads in ERAS with whether it's personal statements, CVs, clinical experience, even doing research fellowships and scholarly for residency programs. Carry on your excellent, really good work, and we really appreciate that.
Thank you. Thank you. Good luck to everybody.